All right, folks. So we'll give this a few minutes to make sure that folks can arrive since we've only got one so far. To you, one person, welcome. Congratulations. You're the first one here, except now you're not here anymore. So um, we'll get this started in just a few minutes after folks get here. In the meantime, I will put this nice little microphone here. Okay. So we're starting to pick up here. Um, so for the three of you that are here, and anybody that might be watching this later, this is meant to be kind of a comprehensive review of the entire appendicular skeleton. You'll remember that the first lab practical we did was all about the axial skeleton, that is, the skull, the vertebrae, and the sternum. We threw that in just for fun. And so this one is going to be all about the rest of the skeleton. So we've got your arms, we've got the three major bones of the upper limb here. You've got the three major bones of the lower limb here. You've got the bones of the pelvic and pectoral girdles right here, minus the sternum. And of course, you've got your feet and your hands. So we'll be going over all those bones in the course of the next hour. As always, if you want to participate, if you want to jump in, if there's a question that gives you trouble at any point, if you want me to clarify something or show you something from a different angle, then feel free to chime in by typing something in the chat box to the right-hand side of your screen. And if that doesn't work, you can feel free to send me an email. I'll be checking email periodically throughout the course of this live stream. I have my email open in another tab here. That's the beauty of these live streams. I can just go back and forth and you still see me, although that might not be a good thing. But enough about me. Let's jump right in. I'd like to start at the top of the body. We'll go ahead and start with these bones right here. We see here the bones of the upper limb, and I know that through the course of these quizzes, I've picked up a few patterns that I think I can help you kind of figure out, a few misconceptions, a few difficulties that I think we can help to clear up with this live stream. So again, if while I'm going through this, anybody has any questions or anything comes up, go ahead and hit me up with a question in the chat or go ahead and drop me an email. So we'll start with the humerus. The humerus, as you know, forms the upper arm. So this part of the arm right here. Now this, and I'll talk about sidedness in a little bit because there are some landmarks that you'll want to know for each of the bones. There are a few that I probably won't ask you about. The fibula, for example, the radius and the ulna generally are a little difficult to figure out. But for this, for the humerus, for the coxa, for the scapula, for the femur, for the tibia, larger bones like that, there are some landmarks that I would expect you to know to help you figure out what side of the body it's on. And my recommendation would be to actually pick up a bone when you get to the lab practical, look at it very carefully, and to figure out what side it's on by actually picking it up and sort of putting it on your body. I will never fault you for that. And if anybody looks at you funny, I will take points off their test. I won't actually do that, but there's no shame in that. So let's start with the humerus without any further ado. So we have the humerus here, and I'll sort of highlight the proximal end. The proximal end, of course, is the end that forms the shoulder joint. So the head of the humerus is right here. That is the part that joins with the glenoid cavity of the scapula to form the shoulder joint. The clinical name is the glenohumeral joint, but we're going to keep it simple. If I ask you what joint that's a part of, it's part of the shoulder. And so the head is right here. Obviously, if I'll stay looking at the anterior side here at the front. The anatomical neck is this line directly below the head. It's pretty easy to remember that because our neck is directly below our head, and the anatomical neck of the humerus is directly below its head. The surgical neck, of course, is right here where my fingers are. And we call that the surgical neck because that's the part that's most often fractured when the proximal end of the humerus is fractured. And so that's where surgical repairs often need to be made. So then we have two sort of processes here that, and I don't want to confuse you too much with that word, but two sort of projections that's a better word. Two projections that serve as sites for muscle attachment, and they both are given the name tubercle. The larger of the two, which sits outside here opposite the head, is called the greater tubercle. And the smaller one, which is right here on the front, the smaller of the two, which sits right here on the anterior side, is called the lesser tubercle. So, my advice, if you're looking at just the proximal end and you want to figure out what side of the body this particular humerus is on, I would look at the head because you know the head is always going to be medial because it has to be. And I would look at the lesser tubercle because the lesser tubercle will always be on the anterior side. So if you position this so the lesser tubercle is on the front and the head is on the inside, then you know that this is going to be a left humerus, if you can see sort of where I'm positioning it here. There are a few other landmarks that I'll talk about when we get to the distal end. So, we have here, as we go down a little bit, and I'm going to sort of try to hold the whole humerus up here. As we look on the outside, we see a little bump right here. That little bump is known as the deltoid tuberosity. And you may have heard that word deltoid before, especially if you're an athlete or if you've studied anything in your human performance classes. The deltoid muscle is a very large muscle that sits sort of on the shoulder here and allows you to raise your arm up to the side. And so that muscle actually attaches right here on the deltoid tuberosity. Fun fact for the day. Now, if we go to the distal end can be pretty tricky. So let's spend some time here. So on the anterior side, we're looking at the front right now. I'm going to try to make sure the glare doesn't get in our way here. You have this opening called the coronoid fossa. The coronoid fossa accepts the coronoid process of the ulna when you flex your arm. So when your arm comes all the way up, it stops because the coronoid process of your ulna hits the coronoid fossa of the humerus, this divot right here. Now you also have the trochlea here. This part here, it sort of looks like a pulley. You can imagine that if this was hollowed out, then you could put a rope here and establish a pulley right here. This actually accommodates the trochlear notch of the ulna, that divot in between. We'll talk about that in a few. So the trochlea is here. Then this rounded part, which, as you can see here, is on the lateral side, on the outside, is called the capitulum. And the head of the radius, that rounded part right here, sits about right here and sort of spins on the capitulum. Then the only other parts that you'll be able to see from the front would be the two epicondyles here. The lateral is on this side. And if you're looking at the whole bone again, you would see that it's on the same side as the greater tubercle. This is the lateral side. And then the medial epicondyle is this edge right here that sticks out a bit more. And again, if you know the head is medial, you know that this epicondyle also has to be medial. Now, if we flip this guy over, you can notice right here that we have a very deep depression. And that deep depression is called the olecranon fossa. The mic I'm using is pretty good, but you might pick up a little background noise from my dogs. Mia is very sad that her mommy has left. So this is, like I said, the olecranon fossa. And the olecranon process, which is the top of the ulna, this part right here, is the part that fits into this. So when you straighten out your arm, it stops because the olecranon process fits into the olecranon fossa of the humerus, this depression right here on the back side. So if you're looking for another landmark, I like to use the olecranon fossa. I like to make sure that this is on the back, and I like to make sure that the head, again, is on the medial side. So there's the humerus. Again, if anything eluded you, if you have any questions about anything, hit me up in the chat box. But with your permission, I'll go ahead and go on to the forearm, the radius, and the ulna. But not before a sip of water. So we'll start with the radius. The radius can be a little tricky, but it's pretty straightforward when you get down to it. So we're looking here at the proximal end. This is the end that articulates or forms a joint with the humerus. The capitulum sits right about here. And this, of course, this rounded part right here, that is the head of the radius. So that rounded part is the radius. And you can remember this is the radius because a radius is a word that you associate with a circle. And this head of the radius is a circle. Now, the head is here. The neck is directly underneath here. And then you have this bump here, which is called the radial tuberosity. Then as you go down to the distal end, two more parts right here. We have the styloid process. This sticks out, and the thumb, the thumb eventually will end up on this side right here. The radius is always going to be on the outside, on the thumb side, if you're in anatomical position. And then on the other side, we have this little indentation here, which is called the ulnar notch. It's called the ulnar notch because the ulna fits right in there at the distal end. So I think the radius is pretty straightforward. One thing that you'll want to remember is that the joint between the humerus and the radius allows us to rotate the arm, to pronate it, and then supinate it. We'll talk more about those joint movements as we go. So that's the radius. And now we have the ulna. The ulna, I would say, is the bone that people had the most trouble with on the quizzes that we've been taking throughout the course of the last 2 weeks. So I want to spend some time here. The way I've explained it to a lot of you is that you can think of the proximal end of the ulna right here like the letter C. You can see right here, C. You can see that there is sort of a curve here, almost like the letter C or almost like a half moon. The top part of the letter C is called the olecranon process. So this fits in, I can show you here, to the olecranon fossa of the humerus. So when you, like I said, when you straighten out the arm all the way, it stops because the olecranon process of the ulna fits into the olecranon fossa of the humerus. So just like this. It's a little hard to do this on camera. So the top, like I said, is the olecranon process. The bottom is the coronoid process, this part right here that sticks out. And the part in between, which connects with the trochlea, is known as the trochlear notch. A lot of words that are very similar, but if you remember that the processes are associated with this bone, the ulna, and that the fossas are associated with this bone, the humerus, you should be able to keep it straight. These are things that may be a good idea to put on your note card if you're not quite sure if you can keep them straight. The only other part up here on the proximal end is going to be the radial notch, this indentation right here next to my finger, and that is where the head of the radius fits in. So when the two bones are together, the head of the radius is nestled in right there on the radial notch. The only other two parts of the ulna that you need to know are the styloid process. Remember, both the ulna and the radius have a styloid process. So if I ask you to label something at the distal end of either of these bones, styloid process is a good guess. And then we have this wider part here, which is called the head. So styloid process, head. So that is the upper limb, the arm. Again, any questions, feel free to hit me up on the side. But after another sip of water, I think I'll move on to the lower limb, if that's okay with you. I'm spilling my water everywhere. It's a mess. So as long as I'm not in a puddle by the end of this thing, we'll be all right. So let's start with the lower limb, the leg. We'll start with the granddaddy of them all, the femur. This is the largest bone in the body. It is the thickest. It bears the most weight. It is also the most difficult to break. It generally is a very, very serious incident that causes one to break one's femur. So we'll start with the proximal end. I'm actually going to have us look at this from the back because there are several structures that are most visible from the back. So, of course, we have the head here. The head is the part of the femur that helps to form the hip joint along with the acetabulum of the coxa. You remember the acetabulum. And then we have the greater trochanter out here and the lesser trochanter on the back of the femur. So again, if we're looking at the back, we're going to be able to see this ridge which sort of connects the greater trochanter here to the lesser trochanter here. All of these projections that we're talking about, whether we call them tubercles or tuberosities or trochanters or processes or anything, are generally speaking sites for attachment of muscles or tendons or ligaments. We'll see a great example of that when we get into the tibia, actually, when we get into this other end of the femur. So the head again, the greater trochanter and the lesser trochanter are the big guns on the top of the femur. And then as we go down, there's a ridge right here where a number of muscles attach, known as the linea aspera. So all of this right here, this ridge right here, is known as the linea aspera. Again, that is only something that will be visible from the back. So if you're looking at this side, do not tell me that it's the linea aspera. It's not going to be there. So as we scroll, we're in a digital world. So as we go down here, we can see now the distal end of the femur. And this is the end that's going to form the knee joint with the condyles of the tibia. So the part of the femur rather that connects to form the knee joint are the condyles of the femur. So we've been kind of looking at these in isolation, but I want to zoom out a little bit and show you the entire bone. So generally speaking, for this bone, the condyles are, or the epicondyles rather, are defined as these edges. There's a little bit as you go toward the back that would emerge right about here, just above the condyles. But for our purposes, I'm going to ask you to identify them from the side. So these are epicondyles. This would be the lateral epicondyle, and this would be the medial epicondyle. And we know it's medial because the head is also medial. So that always try to find those landmarks to help you figure this stuff out. So then, so the condyles are here, lateral here, and then medial there. I have to be very careful not to accidentally stick up my middle finger. I don't want to offend anyone. And then really that's about it. So if I'm looking at this part pointing posteriorly, that was some wording that got some of you on the quizzes, then these are the condyles and these are the epicondyles. So really this is about it for the femur. The femur is a big bone, but there's not really that much to it. If you see a femur tomorrow, you should be pretty pumped because there aren't that many parts and all the parts are pretty easy to make out. So here's the femur. And the femur, of course, now we're in double-digit views. This is very exciting. This is the tibia. So if we zoom out and look at the whole bone, the big landmark. Actually, let me backtrack a little bit. I'm going to grab the femur again. So again, there's this question of sidedness, of figuring out which side of the body this particular bone is on. This is really easy. Like I said, there's huge landmarks. They're easy to find. One of them is definitely the head. The head is always going to be medial. So if we can position the bone so that the head is on the inside, and the one I usually like to use is the condyles, because I know the condyles, like I've said, are pointing posteriorly. So if you're looking at the back of the bone, they're going to be sort of looking straight out at you. So if you can position the bone so that these are posterior and the head is medial, we're going to be able to figure out where it is pretty quickly. So if you'll allow me to stand, this would be a right femur. That way, this is all toward the back, all this stuff here, and this is medial. So now that we've gotten that out of the way, back to the tibia. The tibia is the bigger of the two lower leg bones, and it is the more medial of the two. Remember, this is always going to be on the medial side, and the fibula is always going to be lateral to it. So if we're talking about the medial part of the ankle, for example, the medial part of the ankle is formed in part by the medial malleolus of the tibia. That's sort of the biggest landmark on this bone. So if we sort of zoom out a little bit to see the whole bone, the condyles are sort of loosely defined to be on the top of the bone here. So if we look here, the one on the same side as the medial malleolus will be the medial condyle. The one on the opposite side here will be the lateral condyle. Makes sense. So again, this is one where you can find ways to associate this bone with certain landmarks that will allow you to tell things apart. Then finally, we have this bump right here. I'm going to zoom in a little bit so you can see it. This is the tibial tuberosity. There are lots of pieces of connective tissue that connect here. Most commonly, the patellar tendon, which holds your kneecap in place, attaches right here on the tibial tuberosity. So this is sort of more toward the lateral side. So if you had to only look at the proximal end by the knee, you would know that this, which is a little closer to the tibial tuberosity, would be the lateral condyle. So again, the condyles here are sort of defined on top, and this would be medial, and this would be lateral. So in terms of sidedness, I'm going to try to kind of position myself here. I'm going to try not to fall asleep. So this, we want to position this bone so that the medial malleolus is in the middle. It's medial after all. And we want this tibial tuberosity to be toward the front. So again, you want to find something that's either medial or lateral, and you also want to find something that's either anterior or posterior. So we know the tibial tuberosity is in front. We know this is going to be toward the middle. So again, this is going to be a right tibia. And finally, this is kind of a nice break. Here's the fibula. Pretty simple bone, pretty long bone. This is among the longest and frankly flimsiest bones in the body. If I really wanted to, and if I did not value your taxpayer dollars, I could probably snap this. I'm not going to take on that challenge, but I could totally do it. We all know I'm right. So this has two ends, two parts, really, really simple. The trick is to know which is which. So I'm going to kind of close in on these parts, and I have this arranged correctly. So this is actually, but as luck would have it, this is all of the leg bones I brought home were right leg bones somehow. Didn't plan it that way, but it worked out pretty well. So this is a right fibula. And if we look at the top end here, This is the head of the fibula. You can see how it's sort of diamond shaped here. Um, that's a little better. So if I kind of rotate this slowly, you see that sort of diamond shaped and it sort of comes up to a head here. And so that is the proximal part. That's the part that is superior to the rest of it. Now, if we go all the way down to the bottom, we can see the medial malleolus. Now, the medial malleolus, the big difference here is right here. And you can kind of see it. I'm trying to get the best angle here. So you can kind of see here this little nubbin right here that sticks out almost like a thumb sticking down. That is the lateral malleolus. So if you, and we've talked about this a few times, the bumps on your ankle actually represent the malleoluses of the tibia and the fibula. The medial malleolus is the bump on the inside of your ankle, and the lateral malleolus is the bump on the outside. So these are actually really good landmarks that doctors and nurses and physical therapists can use to kind of diagnose injuries. I had a ligament a couple years ago, for example, that sort of got caught right on my medial malleolus and caused me a lot of ankle pain. And so with physical therapy, with some rest, I was able to kind of figure out how to not have that ligament sort of drag over that little chunk of bone all the time. Trust me, it's not anything you want to deal with. So that's the leg. We've got most of the body down already. Going to grab another quick sip of water. There are only 6 of you, and I have almost 70 in my classes. So, tell your friends. I know everybody's busy, but see if you can get some folks to come out for us. And I'm going to try to stop dripping all over myself. I'm a mess tonight. So the last part is sort of the first part that most of you did in this unit, namely the pelvic and pectoral girdles. The pelvic girdle consists essentially of 2 bones. One bone was already covered on the first lab practical, the sacrum, and the second bone is your friend and mine, the coxa. So COXA, coxa, is the official name of this bone. Don't call it the hip bone. Don't call it the hip. It is the coxa. So it's very important to kind of know the subtle differences between the different parts of the coxa. So we're going to spend a good amount of time here making sure everybody's on track. So we are looking here at the lateral side of the coxa. And the reason we know it's lateral is because this landmark right here, the acetabulum, is where the head of the femur comes in to form the hip joint. This is a super important spot. If you know anyone with a hip replacement, for example, they would get the head. Usually it happens because the head of the the head of the femur erodes over time. And so they replace this with a femoral head that is made of titanium. And it tends to be pretty durable. It holds up better. It doesn't wear down as much as the bone would, and it holds up for a pretty long time. And they sort of shape the femoral head, the artificial femoral head, to fit in to the acetabulum. So the acetabulum is here. Now, if we look at the 3 major parts of the coxa, I'm going to hold it up here. I think that'll be the best angle. So if we look at the bottom, it should be very easy to tell these 2 apart. This is the more medial of the 2 parts. This is called the pubis. The pubis is pointy, as you can see. It's not terribly pointy. I get it. It kind of comes to this blunt end here, but it is certainly pointier than the other part, because if we turn around, we see the nice curved ischium. Now, this includes the ischial tuberosity, which is this curved part right here. The ischial tuberosity is what you are all sitting on right now, unless you're standing up watching a live stream, or lying down, perhaps. If you are, I hope you're comfortable. Don't fall asleep. Wake up. And so the ischial tuberosity is this curved part right here that you sit on. And of course, we have over here this pointy part. Let me make sure I can locate it. And this is the ischial spine. There are a few other landmarks down here that you're going to need to know. The pubic crest, for example, is this flat surface right here. The big opening in the middle that has a number of nerves that go through it is called the obturator foramen. Say that 5 times fast. So the obturator foramen is here. And then as we look toward the back, we have two structures that have roughly the same name. They both accommodate the sciatic nerve, which controls the entire posterior train, all of the muscles on the back of your leg. And this is called, this area underneath here, right underneath the ischial spine, is known as the lesser sciatic notch. And this very large curve right here is known as the greater sciatic notch. So both of these are found toward the posterior end of the coxa. So this is going to be a right coxa. And the reason you're going to know that is because this is going to be sort of pointed up a little bit, the pubis, and it's going to be toward the middle. The other pubis actually would join right here. There would be a link of cartilage right here, and then the other pubis would be like right about here. Then we know that the acetabulum, again, is on the lateral side because that's where the hip has to come in. And we also know that the greater sciatic notch and the ischial spine, all of these structures would have to be posterior. So if we can position the coxa like that, we would know that this is a right coxa. I swear it was a coincidence that I brought home almost all right bones. So if we look a little more closely at the ilium, this was similar to the ilium close-up slide that you had on your scrapbook. We would notice this whole ridge right up here is known as the iliac crest. Then we have several structures that are referred to by the general term spine. This is the posterior superior iliac spine. And we know it's posterior because it's on the same end as the greater sciatic notch. So by process of elimination, this right here must be the anterior superior iliac spine. If you wanted to abbreviate that ASIS, I would not hold it against you. And so these two spines, the posterior superior and the anterior superior, sort of form the borders of the iliac crest up here. You can actually feel, if you feel just under where your belt would be if you were wearing a belt, you can actually feel on the outside the anterior superior iliac spine sticking out a little bit. So this is another good landmark for doctors, nurses, physical therapists. So that's the coxa. Again, this is tough. So if you have any questions, feel free to hit me up. Apparently either I'm doing such a good job or YouTube's got some sort of malfunction because I guess this is speaking for itself. I hope it's helping. So please feel free to chime in if there's something else you need because we only got a few bones left. Now, this is the scapula. And as luck would have it, it is not a right scapula. And I'll show you why in a few minutes. So we did this from a couple different views. So we'll start from the posterior side. Here we have a whole bunch of borders. We know that this glenoid cavity is going to be on the lateral side. So this area underneath must be the lateral border, which means that the side opposite to that would be the medial border. This down here would be the inferior angle. And this up here, this ridge on top would be the superior border. Now, most of the rest of the structures of the scapula center around this length of bone right here. I'll try to get a little closer so you can see. So if we kind of look at this in 3 dimensions here, we see that this is the spine. This is what we popularly know as the shoulder blade. And let me see if this will work a little better. So here we have the spine, otherwise known as the shoulder blade. So on either side of this, we have sort of a depression, a very shallow depression, but this is known as the supraspinous fossa because it's above the spine. This depression underneath here, which is very, very, very shallow indeed, it's hardly a depression at all, is called the infraspinous fossa. Now, the other 2 structures on the scapula that you'll need to know are processes. They are parts that stick out of the bone, and we identified them from this side, from the lateral side. So from here, there are a few things you can do to help yourself out. So this one that kind of sticks out a little bit more from the rest of the bone, what you're seeing here in this area is the spine. This is actually the spine that's going up and down. And so the spine ends in the acromion or the acromion process right here. Then on the other side, all by its lonesome, is the coracoid process. So if you're looking at this bone from the back, kind of like this was the same view, although from the opposite side that you had on the quiz on this particular topic. If you look at the end of the spine ends in the acromion process. So it sort of widens out and flattens to form the acromion. Then the coracoid process is, again, just kind of chilling all by its lonesome out here. It's sort of funkily shaped. It's a little curved, and it is, as you can see, kind of all by itself on the front of the bone. So if you're looking for landmarks to figure out what side of the body the scapula is on, the spine is a great one. This was sort of the OG that I used to kind of demonstrate this technique, so that we know the spine is going to be on the back. We also know the glenoid cavity is going to be on the lateral side. So if we were to put this on our body with this facing front and this facing toward the outside, we would know that this would belong on our left side. So that's the scapula. We have 2 more bones to talk about. This one is very, very simple. This is a rib. We have 24 ribs, 12 pairs. There are 3 types of these ribs. The first 7 pairs of ribs attach directly to the sternum by cartilage. For that reason, they are called true ribs. The next 3 pairs, pairs 8 through 10, attach indirectly to that cartilage via the cartilage of the 7th rib. For that reason, they are called false ribs because they don't quite attach in the way the others do. And there are 2 that actually don't attach to anything in the front at all. They just sort of hang toward the bottom and the back of the rib cage. And those are called floating ribs. All of the ribs on the back attach to thoracic vertebrae. There are 12 thoracic vertebrae. There are 12 pairs of ribs. That is not a coincidence. Now, the end of the rib that connects with that sort of has some funky features. It has some undulations and some interesting shapes to it. You can sort of see as I spin it around here that it is a little bit irregularly shaped. So this end connects with the transverse processes of those thoracic vertebrae. This flat end here, you can see how very flat it is, connects to the sternum. So this is known as the sternal end. This sort of knobby part here that connects to the vertebrae in the back is known as the head. That's really all you're going to need to know about these ribs. You'll need to know the types. You'll need to know which end connects to which end connects to the vertebrae, which end connects to the sternum. And that's really about it. So the last bone up here is the scapula. No, this is the clavicle, but you already knew that. I'm surprised nobody corrected me already. So the clavicle is if we're looking at it from here, we can see that we have one sort of flattened end here where it stops really abruptly. And if we look at this from the side, we notice that this end is a bit thicker. This is the sternal end. This will connect directly to the sternum, the manubrium, the widest part at the top, and that's where it will rest on the center, sort of toward the center of the body. This flatter, broader end here, we can see that it's flatter from the side and it's broader if you're looking at it from the top. This is the acromial end. This sits right on the acromion of the scapula. So this is on the outside, and if you've ever had an injury to your AC joint, that would be an injury affecting your acromioclavicular joint, or the joint where the acromion joins up with the clavicle at its acromial end. So as long as you know the sternal end here and the acromial end here, you're good to go. My recommendation would be to pick it up, put this end in the middle so you know, and then make sure this end's on the outside, just to kind of get your bearings. Okay, so one more sip of water. Hopefully I won't dribble too much, and we'll talk hands and feet, and we'll wrap this thing up. So if there's questions on anything so far, anything at all, go ahead and hit me up in the chat box. Go ahead and send me an email. I'll go ahead and do a quick check of my email right now, and seeing none, we'll move on. All right, we're down the home stretch. So we'll start real easy. Got to figure out where my bones are. Here we go. We got the hand. So the hand is very simple. We are looking right now at the palm of the hand. So we're looking basically at this. So this is how it fits. So if we look at the hand, we see these 8 small bones down here. These 8 bones are carpals. For the purposes of this test, I don't need you to really know what the carpals are. I need you to know where they are at the base of the hand. I need you to know the joint that they help to form. That is, of course, the wrist. And I need you to know the bones that they connect to. The metacarpals up here, as well as the radius, and the ulna down here. So carpals should be very, very simple. I need you to know where they are and what they do. Now, the metacarpals are almost just as easy because there are 5 of them. These 5, I'll try to find a good way. These 5 right here. And we identify those specifically by counting them. So 1 is the thumb, then 2, 3, 4, 5 is the pinky finger. So as long as you can figure out the numbering scheme and as long as you can figure out where the thumb actually is, you'll be good to go there on the metacarpals. Now, the way you're going to know with the metacarpals is that the thumb here has only 2 phalanges. The proximal phalanx here is closer to the metacarpals. The distal phalanx is further away. So the distal phalanx is actually where you're going to have your thumbnail. Now, the other fingers, as you can see, have 3 phalanges, a proximal, a middle, and a distal phalanx. And that's really it for the hand. There are 14 total phalanges in each hand, 2 in the thumb, as we said, and 3 in each of the other fingers. So, last but not least, let's talk about the foot. So this is a left foot, and I'll kind of give you the lay of the land here. You can see, obviously, where the big toe is. It's right in here. We're looking at the top of the foot in this view. Now, here, these 7 tarsal bones that are behind. So we have tarsals, then we have metatarsals, then we have phalanges up here. So you should know all 7 of these tarsal bones specifically. I gave you a quiz that will help you to kind of label those bones, and you definitely want to spend some time with that. I'm happy to answer any questions you might have on that as we go. So As we look at the back of the foot, the heel bone is called the calcaneus. The calcaneus is the biggest of all the tarsals. It sticks out all the way to the back. You can't miss it. Now, the ankle bone, one of the ankle bones, is right here. It's called the talus. So the talus sits on top. You can kind of see that here. So the talus sits on top. It connects with the tibia on the medial side here. It connects with the fibula on this lateral side over here to form the ankle joint. Then we have sort of another row of bones here. This longer one here on the inside is called the navicular. And this one here, which looks sort of cube-shaped, you can imagine it's cube-shaped at least. It's a little more square. That is called the cuboid. And the last three wedge-shaped bones are all given the same name. They're all called cuneiforms. This one right here under the big toe is called the medial cuneiform. This one right here in between, under the second toe, is called the intermediate cuneiform. And this right here is called the lateral cuneiform. So then, as we go through the tarsals, the metatarsals rather. So we just talked about all the tarsal bones. This is the first metatarsal, second, third, fourth, and the fifth is on the pinky toe. Then we have the usual phalanges. We have two proximal and then distal on the big toe, and 1, 2, 3 proximal, middle, and distal on all of the other 4 toes. So, if you are not specifically in my anatomy class at Windham High School, you can probably shut this off right now because I'm going to talk specifics about kind of what we're looking at the next few days for the lab practical. So, the format for the lab practical is a lot like the last one. You're going to have 20 stations. You're going to have a minute and a half per station. You're going to have about 6 or 7 minutes at the end if you need to go back to any station and revisit it. During that time, there's no talking and no peeking unless you're talking to me. If something falls off, if you feel like something moves, if you're not sure what you're supposed to be looking at, you can hit me up and I'll help set you straight. I never want your inability to know what the question is asking to be a reason you get it wrong. So no worries there. And you are allowed a note card. That note card should be one side of a 3x5 index card, no pictures. You know the rules. I'll double check before we start just to keep everybody honest. I don't anticipate having any problems, but take the time to prioritize what you think you'll need. Spellings of words, grouping parts of bones together so you can keep your fossas and your processes straight, things like that. And of course, before I get any of these questions tomorrow, yes, you can retake it. The retakes will be one-on-one, you and me, talking about bones, except there are more bones this time. And all the people who have retaken the first lab practical have done really well. So that is kind of a brief summary of where we're at. Just a reminder that those 3 scrapbooks are due by the time we walk out of the building on Friday for the Christmas break. I do see that I've received some new emails, so I'm just going to double check that we don't have anything here. And actually, as luck would have it, Ava Gravel has sent me a question. Hi, Ava. I hope your track meet went well. And she asked me, let me double check here. For the ribs, will we need to know everything about the different types or just the names and numbers? So in terms of the ribs, you should know that there are 3 types of ribs, true, false, and floating. You should know that there are 24 ribs or 12 pairs in all. I'm not incredibly concerned even that you can sort of break down the groupings. If you know that there are 3 types, if you know that there are 24 ribs in total, and if you know which end of the rib connects to what, you're going to be just fine. So good question. Glad I could clarify. Hopefully I could clarify that for you. And I believe that there's nothing else for right now. We're at about the 50-minute mark here, so I'll give you a few minutes to ask any questions in the chat box if you have them. And if not, then we'll probably log off in a few. So if you're feeling good about where you're at, feel free to leave now. I'm not going to kick you out, but we're kind of winding down here, and I've got another live stream in 9 minutes. Let's go. We're going to make this happen. So another sip of water. In the meantime, if you got some questions, go ahead and hit me up on the side. And if not, then we'll start winding this down. Okay, so looks like new people are showing up right now. There must have been sporting events that just got out. So it looks like seems like people are feeling pretty good. So unless there's some last minute questions, I think we'll wrap it up for now. If anything comes up between now and then, we'll have our usual sort of Q&A portion before the test starts tomorrow and Friday. So let me know if there's anything specific. I'll have a box of bones, probably this box of bones, for you to look at and share. And we will take it from there. Ava asks a very important question that I should clarify. Now, she asked if points will be taken off for spelling. I'm generally pretty forgiving on spelling. If I can pretty much tell what you're getting at, I'm going to give you credit. However, keep in mind that you do have a note card. And so I feel like the note card, if it's being used well, should partially serve as a word bank. So if you're having trouble kind of spelling some things, it would be a very good idea to write that stuff down on your note card to kind of save yourself some aggravation. So hopefully that helped. We're now at the 53-minute mark, and we have the most viewers we've had all hour. So those of you who are just arriving, sorry you missed it. In about 5 minutes time, this is going to be available on my YouTube channel. And if you're taking chemistry tomorrow, we got a live stream starting in about 7 minutes. So I'm going to take a little break and get ready for that. And in the meantime, if you have questions, you know where to find me. So study hard, finish those scrapbooks, use all these great resources at your disposal, and let's knock out a great lab practical on tomorrow and Friday. Thanks for watching, guys.